Hi everyone, this is Dr. Srinivas Iyengar, Director of Structural Heart here at Boulder Community Health. I'm here with Eric Pashotti, cath lab nurse, to discuss a subject called aortic stenosis. Aortic stenosis is a condition where the aortic valve does not open well. It can lead to symptoms of shortness of breath, lightheadedness, chest pain, and even heart failure. Number of patients need to be treated with some type of procedure because medications are usually ineffective to treat this condition. One of the therapies we have here at Boulder Community Health is called TAVR, transcatheter aortic valve replacement. One of the valves we'd like to show you today is called the Evolut FX valve. It is made by Medtronic and is a valve that has excellent durability data and is shown to really be effective in treating patients with the symptoms of aortic stenosis. So Eric, I'd like you to hold up the back end of this catheter. So this device does not all go into the patient's body, but rather from this length to here, we are actually inserting through something called the femoral artery or the carotid artery into the patient. This back end is outside the body, so this does not go into the patient. But once this device does go in and we cross the aortic valve, Eric, would you like to start opening? What we see is the valve will actually start moving forward, and this area here will actually have the valve itself attached. This current model does not have that valve attached, but what you would see is this then come out and be deployed in a patient's heart across the aortic valve. This valve is fully functional immediately after deployment. There's no sutures, there's no glue, there's no reason for any other device to be put in to keep this in place. And after the valve is deployed across the aortic valve, this is actually a design of how it looks. Whereas the aortic valve is right here, this valve is deployed right above the native aortic valve and is immediately functional. And this is the way at this point in time that patients with severe symptomatic aortic stenosis can be treated successfully. We'd like to show you an animation for further evaluation of how this device is deployed in the body.
Transcatheter aortic valve replacement, or TAVR, is a treatment option for people with symptomatic severe aortic stenosis that does not require open heart surgery. Severe aortic stenosis occurs when the aortic heart valve does not open and close properly. This makes your heart work harder to pump blood to the rest of your body. A diseased valve affects your health and limits your daily activities. Before the procedure begins, you will be given anesthesia or a mild sedative to make you comfortable. The entire procedure typically lasts an hour or less. The arteries in your body are like a system of roads that branch out from the heart. There are different routes that your doctor can use to implant the Medtronic TAVR heart valve, and all come with their own individual risks. These routes typically include an artery in your leg, an artery in your neck, and a space between your ribs. Speak with your doctor about which route is best for you. In a typical Medtronic TAVR procedure, the doctor makes a small cut at one of these access points and guides a thin, flexible tube with the TAVR valve into your artery and to your diseased valve. Throughout your procedure, your doctor will be viewing images of your heart. The Medtronic TAVR heart valve will be placed in your diseased valve, and the self-expanding frame is designed to enable your doctor to deploy it in a controlled and accurate manner. After expanding, the new Medtronic TAVR valve takes over the old valve's function to help blood flow efficiently out of the heart. Your new valve will begin to work immediately. To complete the procedure, the thin, flexible tube will be removed and the cut will be closed. All medical procedures have risks. TAVR risks may include, but are not limited to, death, stroke, damage to the arteries, bleeding, and the need for a permanent pacemaker. Please talk to your doctor to decide whether this therapy is right for you.